In this video, we're going to explore the question, do you have depression or do you have chronic fatigue? So to help us answer this question, the first step is to define what each of these conditions are. We can then look at some of the important differences. So depression is an ongoing state of low mood. It's often characterized by things like a sense of helplessness, a sense of low self-esteem, a sense of pointlessness about life. And depression is not just having a bad day or two and just feeling a bit fed up and pissed off with our life, but it's like an ongoing state that we feel that we're not able to easily get out of. So let's now define what we mean by chronic fatigue. So it could be ME, chronic fatigue syndrome, fibromyalgia, Lyme disease, long COVID, and so on, what I would classify as fatigue-related conditions. And although there are some differences in terms of those conditions, the core underlying symptom is one of fatigue. This could be alongside symptoms like dizziness, muscle pains, immune sensitivities, and so on. So there's a lot of similarity between these two conditions, depression and fatigue-related conditions, but there are some very important differences as well. With depression, although it can feel very much like we are fatigued and drained and tired, the core issue is one to do with our mood and our psychology. With depression, the research shows us that if someone who is diagnosed with depression exercises regularly, they will actually improve their mood and they will improve their energy. The opposite is the case with chronic fatigue. Someone has chronic fatigue and they push themselves to exercise when they don't feel like doing it, they will typically feel significantly worse for doing it. In fact, they may well also experience post-exertional malaise or a delayed fatigue response, where they may feel okay doing that thing, but a day or two afterwards, they will then crash. One of my colleagues once described the difference here as someone who has depression, all they want to do is get into bed, hide under the covers, and disconnect from the world. With chronic fatigue, it's the opposite movement. People want to be able to get out of bed and come into the world. If you're finding this video helpful, do subscribe to our channel here on YouTube and click the notification bell, and YouTube will let you know as new videos are released. Now, of course, if someone is suffering from ongoing fatigue symptoms, it's not surprising that over time, low mood is going to sit alongside that. That is a completely normal response to not being able to do the things that we love in our life. It's also true that someone that's in an ongoing state of depression, particularly if what's happened is that they've started to limit their life and they started to withdraw from the world, they're going to feel more fatigued as a result of that. But this distinction is critical when it comes to intervention. And I have seen so many cases over the years of people who have chronic fatigue that have been misdiagnosed as having depression, that have then been either persuaded or even pushed to do activity levels beyond what they're able to do, and it's made them worse, not better. And so having an accurate diagnosis is really important. That diagnosis, therefore, can help us determine not just this distinction between how we manage activity levels, but also having appropriate therapeutic intervention. So to learn more about this distinction, do check out my book, Decode Your Fatigue, where I give you a roadmap to not just decode the causes of your fatigue, but also help you to map a pathway to recovery. I also talk about how to manage your activity levels in such a way where you're learning to listen to your body, not just push through. And do let me know in the comments below this video, what's been your experience of the difference between depression and chronic fatigue. And I look forward to talking with you in our next video very soon.